Hi everyone, this is Sean with the MassSupport Network here with your COVID-19 update for Tuesday, September 22nd, 2020. So looking at today's case counts, worldwide we saw another 2 million cases in the last week, with in the US seeing 310,000 new cases, and here in Massachusetts, just under 3,000 new cases. So this is an increase across the board there. Worldwide, that's another about 100,000 new cases, as what the gain was last week. In the US, this is a jump of about 30,000 additional cases. And in Massachusetts, we're seeing a couple hundred extra new cases per week right now. In Massachusetts, this is hopefully driven by our increased testing, but worldwide in the US, this is definitely some increase in spread, as we'll see on the next slide. In terms of deaths, we're coming up on some unfortunate milestones here, with the world at over 960,000, seeing about 36,000 deaths in the last week, which is slightly down from where it was last week. The US, things are holding about steady at about 5,500 deaths per week. And here in Massachusetts, we saw just under 100. So looking across the country here, this is the COVID tracking project's data on tests, cases, hospitalizations, and deaths. Tests are going up, but so are cases. We had that drop off in testing last week and the week before, but the cases are spiking significantly. And as you can see from this chart, this is the first major increase since the July spike. So that's something to look at. We'll look at that closer in the next slide. The other metrics, hospitalizations and deaths, are declining. So looking at where we are with cases, we had a steady decline in early September, and we've basically made up all of that in new cases. A lot of this is likely driven by school reopenings, and maybe that'll come back down again, but if schools are driving new spread, we may see increased spread, may see additional gains here, or may plateau again at this level. It's hard to say at this point. Looking at where this is happening around the country, while there is gradual increase in the Northeast, it's really the rest of the country that's seeing these spikes. You can see that same dip and spike in all three other regions there, with the South coming down a little bit afterwards. And now there was that drop in testing for a little while there, but again, that's happening pretty much across the board there. They have this increase in testing in cases. So in terms of developments, a couple of big things over the weekend. Most notably on Friday, the CDC updated its official COVID guidelines, stating that aerosol transmission is a major factor in COVID spread and, quote, thought to be the main way the virus spreads, unquote. This was greeted by general cheers from the public health community that quickly turned to raise eyebrows as the CDC retracted that statement on Monday morning, stating it was a draft document of proposed changes that was not supposed to be posted. So now there's considerable confusion as to what the CDC's actual position will be, and we await the final draft, which is as of this recording at about 10 a.m. on Tuesday the 22nd, has not been published yet. But briefly, the CDC said that aerosol transmission was thought to be the main form of transmission, and then it has been retracted, going back to the close contact droplet spread that it said before. In other news, New York City is beginning staggered reopening of schools. 90,000 students returned to school in New York City yesterday, beginning with the youngest students and those with disabilities. Elementary school students return or plan to return on the 29th, I believe, and then high school students on October 1st. So we will see how this affects spread in the city, which has gotten its transmission rate very low. They've got a percent positivity less than 1% down there. And there have been some hiccups in the rollout, but since we're not New York based, well, we'll more focus on what that means for COVID spread. Speaking of which, Europe is definitely in the beginnings of a second wave right now. Spain and France are seeing 70,000 new cases apiece in the last week. The UK saw 25,000 new cases in that time, and the rate is increasing. Experts in the UK are forecasting a potential 50,000 cases potentially per day by early October. So all these countries are moving to measures such as increased lockdowns, usually more targeted than they were in the spring, travel restrictions, so forth, with neighboring countries starting increased testing of travelers. And we'll see if these measures are able to contain the spread before it really reaches new heights, or if the spread is already big enough that we're going to see unprecedented spikes. Another big wave, though not really Europe, is Israel, who's seeing 30,000 new cases per week, though Israel has arguably been in a second wave for quite a while now, but is hitting a spike similar in proportion to our July spike in an already high wave. Checking in on vaccines, two more projects entered stage 1 last week, and another project has entered phase 2 in testing. Also, there are 2 additional vaccines in early use. Those were approved in the United Arab Emirates, 2 vaccines made by the Chinese company Sinopharm, and they've been approved for healthcare workers in the UAE. The other 3 vaccines which are in early use are 2 in China, largely for the military, and 1 in Russia. I believe it's mostly for healthcare workers at this point. All right, you can find the stats and trends through the COVID Tracking Project, the New York Times, and mass.gov. And for more of the MassSupport Network, you can find us on social media or on our website. Remember, wear your mask, wash your hands, and we'll be here if you need us. Stay safe.